I've been associated with Mary Free Bed for 57 years.
This is where he feels like he can. This is where he's accepted for who he is, for how he is.
Everybody at Mary Free Bed has touched a part of me. They are the most caring and lovable people.
They have things like the Mary Free Bed Inn. We moved all the way from Benton Harbor. These guys have a hotel to stay in. It's like it's everything you can ask for rehab. It's like they answer your questions before you ask them.
Josh is just learning, with us not holding the walker so much for stability, how to do it. So it's a kind of a new area we've progressed to.
We're about function. We're about doing. Living and doing is our mantra. Each individual we allow to be more functional, and that then equates to higher quality of life. One of the things that we do at Mary Free Bed that you're not going to see at other institutions are that we meet together formally as a team, and we sit down and with every team member in every discipline, sit down and say, what are the goals that we have for this patient, both short and long term? And we constantly redefine those goals as a patient goes through the process of being at Mary Free Bed.
Very nice.
It's always been about the people. It's always been about taking care of the patient. And literally, how would you want your family member to be treated? Everybody here believes and treats every patient as though it were family.
The connection between a therapist or a physician or a specialist or a nurse and the patient when they're together is the most connected thing I've ever seen. The focus is totally on the patient. It's a loving look, true compassionate, loving look, and it's as if that care provider has no other care in the world but that patient.
We have one of the most extensive recreational therapy programs and what I'll call adaptive sports programs in the country. And that's a real commitment of Mary Free Bed and our guild to our patients. These aren't areas that are often served in most communities. What an incredible gift it is for our community to have this adaptive sports programs.
Work hard, skate hard, like Kaz said, okay? This is the time when you're gonna get better.
This staff is so knowledgeable of equipment that's available, of therapies, of treatments. They are able to make things here for you. And we've watched that progression, because since '93, we have watched the progression of what's available, and they're always trying to stay right on top of things.
One example I think for me that is just phenomenal is our motion analysis lab.
Our whole purpose here is to give treating clinicians more information than they can get just watching somebody walk in the clinic.
This is the state of the art for determining how we best treat walking impairments in children and adults in the year 2013.
Mary Free Bed is one of 9 accredited facilities in the world. That accreditation basically tells the community that our service has been vetted by other professionals in the field for quality and consistency of data. We have force plates embedded in the walkway that allow us to understand the forces that are coming up from the floor through the limb. We're also recording about 120 frames per second in the motion capture.
As the patient comes through the space, you can see that the red arrows are visualizing how the foot interacts with the floor. Combined with our motion data, as you see here as our patient comes through the volume, is calculate how those forces are distributed through the joints, from the ankle to the knee to the hip.
Our study is very cost effective as compared to ordering braces, prolonged therapy, surgical procedures that may not be to the patient's best advantage.
We look at the patient on a one-on-one basis and figure out what are their specific needs to accomplishing whatever task it is, technology related though. That could be from addressing computers, since I no longer have the physical function to be able to do this. Maybe it's environmental control, turning on lights and answering telephones and turning on their stereo system, TVs, those kind of things. There's not a ton of people around that are educated in this area to be able to meld both the commercial industry products that are available with the assistive technology specific products. That melding together is what makes us special.
The patient will come in for an evaluation, and that is where they decide what type of frame they want, what type of other supports that they need. I talk with therapists, we interact a lot, and it's all very hands-on, and we measure kind of what we want, as far as trunk supports here, where we want them to be, where we're going to cut them out, to get feedback from parents of pediatric kids that like they are just sitting better, they're comfortable, they are in their chair a lot longer than they've ever been. Not too many jobs where you get satisfaction at the end of the day knowing that you helped somebody make their life better.
What we're planning to do in general here at Mary Free Bed is determine, are these devices really as effective as it would seem? Does this really change the patient for the better? Do they truly walk better, faster, use less energy, have fewer deviations in the way they walk?
We have therapists who do nothing but spinal cord care. That is different from any other place in the state of Michigan. We have therapists who specialize in brain injury, in stroke, in pediatric care, and in cancer, as well as medically complex problems. So when individuals require comprehensive care from experts who do nothing but take care of certain diagnoses, you go to the person who does that on a regular basis.
We're changing the future of people's lives. So somebody who has a disability, we're helping them get better so that their futures are what they want them to be.
Absolutely, 100% true. They got my hope and I have my freedom. Because I would not have had that had I not come to Mary Free Bed.